Okay, students, we're going to keep going through the brain. There's probably going to be 3 different PowerPoints on the brain. It's important that you review all of this so that you are familiar when you get to lab. As you have now seen, you got to be pretty fast to get through the lab and know your material. So picking up where we left off, here's the MRI axial T1 with the longitudinal fissure. Here's your corpus callosum, your GNU. You can see where it's slicing through. So here, that's the bottom part is your rostrum, then your GNU, then the body, and then your the posterior portion, which is your splenium. So here's your corpus callosum, and that is your GNU with your septum, pedunculum, and then you have your third ventricle, and here is your thalamus, and here is your splenium of your corpus callosum. All right, so here is right down the middle. So we are just in the body of your corpus callosum. Callosum, easy for me to say, can't say it fast. Here's your suprasellar cistern. This is your pituitary gland here. In the fat in between is your suprasellar cistern, and your optic chiasm is right up above. So when I talk to you guys about pituitary adenomas or any kind of pituitary tumor, they grow upwards typically. Well, hopefully they grow upwards and give you blurred vision, so that's pretty normal. On either side is your internal carotid, so you don't want it to grow laterally, as you'll be in really bad trouble. You here, the lighter gray portion is your white matter and the darker is your gray matter. Looking at an axial here, we have your frontal lobe. Here is your GNU of your corpus callosum, your anterior commissure. Here, right down the middle, is your third ventricle with your thalamus around it. We have your temporal lobe, occipital lobe, and I want you to know your lateral ventricle there. Axial T2, your anterior commissure, posterior commissure, your third ventricle runs right between the two. Your pineal gland is there. On CT it'll calcify so you can see it well. Here's your lateral ventricle, your right lateral ventricle, occipital horn. Looking at this slide, the main thing that I want you to see is your central sulcus with your precentral gyrus with your postcentral gyrus. That's the most important part, in your Broca's region there. So looking here is your temporal lobe. Coming down, you have your third ventricle with your thalamus and your occipital lobe. Your insula is the thicker gray matter around your sylvian fissure and your frontal lobe up front. This is a CT post-contrast. This looks like an angiogram. So this is your right parietal lobe, left ventricle. Here we're cutting right down the middle, so this is the body. So you have your left and your right. Your dorsum sella, and you can see, if you mag that up, you'll be able to see that that's what that is. This is your sphenoid sinus with your right temporal lobe and your sylvian fissure. Over here you have your frontal lobe, your lateral fissure, sylvian fissure, temporal lobe, cerebellum, and your insula is the thick matter around your lateral fissure or your sylvian fissure. This is your caudate nucleus. You have your head of your caudate nucleus, the body, wrapping around to your tail and your amblygotta, and your lentiform nucleus is here with your thalamus back here. So when we look at a sagittal, this is a proton density, a spin density, kind of T2 weighted. So your lentiform nucleus here, your head of your internal capsule, and let's see, your caudate nucleus with your hippocampus. Yeah, I agree with that. And that's good on that one. So axial view of your basilar nucleus. If we look here, it's important that you be able to label this. So you have your anterior horn of your lateral ventricle on the left. You have your head of your caudate nucleus right there. Coming around, you have your claustrum, this little thin stripe, and this is your lentiform nucleus, these two. And I typically don't have you differentiate between the two. It's hard to tell the difference between the two. So this one is your putamen and your globus pedalis, but lentiform nucleus for these two. Back here is your splenium of your corpus callosum, your thalamus, so your third ventricle is running right down the middle there. Here's the tail of your caudate nucleus, these little ditzels there. Fornix in the middle and your internal capsule here. So looking at an MRI, this is a T1. Here's your anterior horn of your lateral ventricle, your insula, I think that's what that is. Oh, lentiform nucleus, sorry, losing my mind. Your insula is right here, so it's just lateral to it. The globe, I won't have you label that, so this will just be your lentiform nucleus. So you can see this right here, and then there's another one right here. Coming down and around, here is your thalamus, so your third ventricle, and we have your claustrum out lateral, and we have, there's a lot on the slide, sorry, your external capsule running here, and your INC is your internal capsule. So external capsule, internal capsule, this is your head of your caudate nucleus, and your lentiform nucleus are these two. You don't have to divide out between the two different ones. On CT, as you can see, it's hard to see. So here is your head of your caudate nucleus, and here it's hard to see is your lentiform nucleus. And I wouldn't have you label it on a CT, as you can see. Very difficult to see. Now that you know what you're looking for, you can see the two, but it's still very hard. Okay, here's a coronal picture. So this is sliced kind of anterior. So if we look at this, this is, I just have you label the corpus callosum. I'm not sure if it's your rostrum or your gnu. I'd probably say gnu if I was going to label it. So you got your head of your caudate nucleus with your lentiform nucleus here. It's a great picture of it. So here's your optic chiasm with your suprasellar cistern in between the optic chiasm and your pituitary gland. Your claustrum, you can see the little line right there, and you can see your insula from your Sylvian fissure, how thick that is. Your internal capsule is here. Here's your optic chiasm with your suprasellar cistern and your pituitary gland. We head over here. We have your thalamus, your hypothalamus, your optic nerve coming down there, your midbrain, your pineal gland, and I want you to know your cerebral aqueduct. So your third ventricle is here, your cerebral aqueduct, your fourth ventricle. Here's your cerebellum, and your medulla oblongata with your pons, pituitary gland, infundulum, and your optic nerve, like I said, and your hypothalamus. So here's the coronal again. So this is cut pretty much the same spot. So just review. Here's your corpus callosum, your head of your caudate nucleus. Here's the lentiform nucleus, your optic chiasm, your pituitary gland, claustrum. You have your external capsule and your internal capsule coming on the inside. So you see your internal capsule really well on your coronal, and your septum pellucidum. Here's the brainstem. So you have your thalamus here, your midbrain, pineal gland. I want you to know your cerebral aqueduct, fourth ventricle, cerebellum. This is your cerebral tonsil, and it's important that the cerebral tonsil is superior to the posterior portion of the occipital bone. If it's below, it's called Chiari. So this is a mild Chiari. This would be like a Chiari 1. So what happens is when it drops below the base of the skull, then it's called a Chiari. So here we have your medulla oblongata with your pons, your midbrain, pituitary gland, infundulum here, your hippocampus here, and your optic nerve you can see right there. Okay, optic chiasm, suprasellar cistern with your pituitary gland in the middle here, so you can see that with your sagittal sinus just below it. Internal carotid artery with your pituitary gland. I wanted to show you this because if the pituitary tumor grows laterally, it's going to wrap around your internal carotid arteries, and to do surgery on that is very, very risky, and because if they dissect your internal carotid artery, you're pretty much going to be a vegetable. Okay, anterior commissure, posterior commissure. So you have your third ventricle running down the middle, you have your pineal gland posteriorly, and you have your occipital horn of your lateral ventricle on the right. And occipital horn of your lateral ventricle, and this is a CT, so you can see that the pineal gland is calcified. You also have your choroid plexus that's calcified within there also. Very common. Your limbic system, the main thing I want you to look at here is your anterior commissure. I want you to come around to know your corpus callosum is on the inside. This kind of hovers over. You have mammillary body, what else do I want you to know? Hippocampus and your perihippocampal gyrus, and as you can see your amblyoptia in there. Olfactory bulb, and I'll show it to you on some of the images. So your optic tract, you can see it right there, and I want you to know your hippocampus, your mammillary body, that little ditzel, and your amblyoptia there. And on CT, very hard to see, this is your ambient cistern with your posterior cerebral artery back here. So coming down here, we have your cingulate gyrus, your corpus callosum, and your fornix here. Here's your hippocampus with your cerebral aqueduct coming down the middle. So your fornix with your posterior commissure right there, and your thalamus is right here, and pons, third ventricle coming down the middle, and your hippocampus right there. Pineal gland, this is your inferior commissure with your cerebral aqueduct, your cerebellum, and here we have your cerebral punctacles, and I want you to know your red nucleus and cerebral aqueduct. So if we're looking here, we have your cerebral punctacles, we've got your red nucleus. You can see the two densities right there. That's your red nucleus. And I want you to know, it's hard to see the mammillary body, so I wouldn't make you label that. Here is a CT post-contrast, looks like an angio, and I want you to be able to label nothing. Coming through here, this is your fourth ventricle. I wanted you to be able to see that with your cerebellum, your pons right here. So if you see your fourth ventricle, typically you're at the level of your pons. Here's your hippocampus right there. And your insula with your pons. This is your basilar artery, the white dot, so this is contrast. This is your pons and your fourth ventricle with your cerebellum, so kind of get grounded here on where we're at. Your basilar artery is that little dot, and your pons, your fourth ventricle, your cerebellum. Coming over here, we have your olive and your CPA. Here's your clivus. You remember that one. Inferior, I won't make you know that. So the vermis and your fourth ventricle. So medulla oblongata, you can see where we're slicing through right here. So we're below the pons, so we're at the medulla oblongata. Here's your cerebellum, your fourth ventricle. I want you to know your olive there. And your pineal gland, your, well, do I want you to know that? No. Your cerebral aqueduct is important with your olive. You can see your olive really well right there. And lay of the land there. We are going to stop there. I'll pick up on the next PowerPoint at this slide.